Welcome to EuroPCR 2025. I am Martine Gilard from Brest, and I have the pleasure to be with Antonio Mangieri from Milan and Marco Barbanti from ENA. So we will discuss about the presence of coronary artery disease and patient who needs a TAVI. So my first question to Antonio will be, do you perform an angiocoronarography systematically before the TAVI?
Okay, that's a very good question. I think it's not mandatory to perform a coronary angiography in all our patients that are screened for TAVI. Essentially, our way to proceed is usually to undergo a CT scan before TAVR, just to make sure that the anatomy is suitable for our implant. And at the same time, so the CT scan can give us some information about the coronary anatomy. And if we see large amount of plaque, which is located in the proximal part of the vessel, I think it's a good practice also to go for a coronary angiography in those patients who can have also a silent coronary artery disease. So we want to treat the TAVR, but we don't want to over-treat CAD because we know that in some patients it's an innocent bystander.
So, Marco, should we perform PCI for every patient who have a coronary artery disease and we want to have a TAVI?
Well, coronary disease and severe aortic stenosis, they very frequently coexist. According to the guidelines, last guidelines, we should treat both coronary disease and severe AS, but these guidelines are more designed for a surgical patient population, which means that they do not stage the procedure and have to do it at the same time. I think one of the most important part of our job as interventional cardiologists is that we can stage procedure. It means that when we have this two important pathologies such as coronary disease and severe AS, we might think to consider which is the predominant disease, which usually in most of the time is a severe AS. So probably we don't have to say that all patients with significant coronary disease should undergo PCI. I think it's a very global assessment of the patient, including the potential prognosis, the complexity, the severity of coronary disease, how much it could be the rate of complication, potential complication of treating very calcified coronary disease in all the patients. I think look out also to the symptoms. If the patients have no angina, no diabetes, diffuse peripheral disease, probably it may be a wise choice not to be aggressive and treat the severe AS with TAVI and then wait and see what happens to the coronaries.
Yes, that's clear. So now I think the most important question, when we decided to perform a PCI in patients who will have a TAVI, when? Before, concomitant, and after the TAVI procedure?
We have very good data coming from a registry called the diagnostic registry, in which we investigated basically this issue. We observed a higher rate of complication when operators decided to do concomitant strategy and revascularization with the TAVR in the same procedure. I mean, we observed a high rate of vascular complication, we observed a high rate of bleeding events, and for sure we have also some issues about the risk related to the contrast administration. So according to this registry, we know that it's not randomized, it's not prospective, but it's just a retrospective registry, so he has a lot of limitation. But we can say that it's better in these type of patients, which are mostly fragile, to postpone or to anticipate the revascularization compared to the TAVR procedure. And I think that the decision to do PCI before or after, or to leave the CAD like that, is basically based upon the clinical judgment that you give in these patients.
Yeah. So Marco, in your daily practice, when do you perform a PCI in this patient?
Well, I particularly agree with this data presented by Antonio. I think stage the procedure is a wise choice in most of the time. In my practice, we basically, when I face a patient with combined pathologies, I basically consider two things. The first thing, what is the burden of coronary artery disease? So what is the complexity of coronary disease, which is the myocardial risk for that particular patient. And another point is what happens in case I have a transcatheter valve inside, which means how accessible are these coronaries after transcatheter valve implantation. Because usually if I have a patient, if I anticipate a patient where I do not anticipate any issues for coronary cannulation after TAVI, probably more recently my approach is to do the TAVI procedure and then do the coronary vascularization in a second time. Sometimes I want to wait what is the clinical impact, because sometimes this is a very long-lasting coronary artery disease, and probably you can just do the procedure, the PCI, guided by symptoms. Because as Antonio said, the acute coronary syndrome in this particular patient is not very high rate, so you can really go in a tailored approach and postpone a procedure. When I do before, only when I have a very massive coronary disease involving left main and a major vessel that could hamper the safety of the TAVI procedure. This is the only way I
So thank you so much for all this information. If I can summarize what you said, it's not mandatory to realize a coronary angiography before the procedure. It depends on the patient. We need to make a PCI with patients who have TAVI and also coronary artery disease when these coronary artery diseases are complex or very important, and also when, before or during or after. It depends of the clinical and the complexity. However, there is more complication when you perform the PCI during the TAVI procedure. So thank you so much to you all.